Today we're talking about a topic that TikTok loves to dramatize: advanced maternal age. Yes, that phrase, the one that makes perfectly healthy 35-year-olds feel like they just turned 97 overnight. Let's break this down calmly, medically, and without fear-mongering. Today we're talking about a topic that TikTok loves to dramatize: advanced maternal age. And if you've ever heard that phrase and felt personally attacked, I get it. It sounds dramatic. It sounds scary. It sounds like the hospital is about to hand you a knitting kit and a rocking chair. But let's slow down and talk about what this actually means. Calmly, clearly, and without the algorithm yelling at us. Advanced maternal age is simply a medical classification for pregnancy at age 35 or older. That's it. It's not a moral judgment. It's not a prediction of doom. It's not a countdown timer that explodes on your 35th birthday. The term exists because statistically, certain risks increase gradually with age. Medicine uses categories to guide screening and counseling. It does not use them to define your worth, your capability, or your future. Now, about that idea that fertility falls off a cliff after 35, that's one of TikTok's favorite sound bites. Biology is not a cliff, it's a slope. Fertility does decline over time, but it happens gradually. The chances of chromosomal differences, like Down syndrome, do increase with age. But we're usually talking about a shift from very low risk to still relatively low risk. Most pregnancies in the mid to late 30s are healthy. Context matters, and viral videos often skip context because it's less dramatic. Another thing social media doesn't always explain is that age is only one piece of the puzzle. A healthy 39-year-old with stable blood pressure, no unmanaged medical conditions, and good prenatal care may have fewer complications than a 24-year-old with uncontrolled diabetes or severe hypertension. Overall health, genetics, lifestyle, and access to care play huge roles in pregnancy outcomes. Medicine looks at the whole person, not just the number on a birthday cake. The good news is that prenatal screening has improved dramatically. We now have non-invasive prenatal testing, NIPT, high-resolution ultrasounds, and access to genetic counseling. Being 35 or older often means you're offered additional screening options, not because something is wrong, but because we have tools that can provide more information. And more information can bring reassurance and allow families to make informed decisions. There's also this cultural pressure that if you're not pregnant by 30, you've somehow missed your window. That narrative ignores real life. People pursue education, careers, financial stability, partnerships, healing, or simply wait until they feel ready. Many people conceive naturally in their late 30s and early 40s. Some need fertility support earlier in life. There is no universal reproductive timeline that applies to everyone. Your fertility journey is not a viral trend or a competition. And finally, fear-based advice is not the same as medical advice. If a video starts with "doctors won't tell you this," I promise you, we will tell you. We discuss risks openly. We explain statistics. We personalize recommendations. What we don't do is shame people for choosing when to grow their families. Advanced maternal age is a data category. It is not a destiny. It does not define your pregnancy, your health, or your value. Evidence-based care should guide your decisions, not the For You page. Today we're talking about a topic that TikTok absolutely loves to dramatize: advanced maternal age. You've probably seen the videos: dramatic music, bold text, someone whispering about how fertility drops off a cliff at 35. So let's take a breath and replace the panic with actual medicine. First, what does advanced maternal age even mean? It's a clinical term used for pregnancy at age 35 or older. That's it. It's not an insult. It's not your body suddenly expiring. It's a statistical category that helps guide doctors in offering certain screenings and having informed conversations. The term exists because on population-level data, certain risks increase as age increases, but population statistics are not personal prophecies. Now let's address the big viral claim that fertility suddenly collapses after 35. Biology does not operate on cliffs. It operates on gradual change. Fertility slowly declines over time, beginning in the late 20s and continuing through the 30s and 40s. The shift at 35 isn't dramatic. It's simply a point where medical organizations historically noticed measurable statistical differences in chromosomal risk. For example, the chance of chromosomal conditions like Down syndrome does increase with age, but increase does not mean likely. It often means moving from a very small percentage to a slightly larger small percentage. Most pregnancies at 35, 37, even 39 result in healthy babies. That nuance doesn't always fit into a 30-second video, but it's crucial. It's also important to understand that age is just one factor among many. A person's overall health often matters more than the number itself. Someone who maintains healthy blood pressure, manages chronic conditions, avoids smoking, and has consistent prenatal care may experience a smoother pregnancy in their late 30s than someone younger with untreated medical issues. Medicine evaluates the whole person, not just a birth date. Another piece TikTok rarely highlights is how much prenatal care has advanced. We now have non-invasive prenatal testing, NIPT, detailed anatomy ultrasounds, and access to genetic counseling. These tools allow earlier and more accurate screening than ever before. If you're 35 or older, your provider may offer additional testing, not because something is wrong, but because more data can empower informed choices. There's also a social layer to this conversation. Many people today delay pregnancy for education, careers, financial stability, partnership timing, or personal readiness. That doesn't make them irresponsible. It reflects changing life patterns. Yes, fertility changes with age, but reproductive decisions are complex and deeply personal. There is no universal correct timeline. Fear-based messaging tends to oversimplify biology. Statements like "doctors won't tell you this" are usually followed by exaggerated or out-of-context statistics. In reality, healthcare providers absolutely discuss age-related risks. The difference is we do it with context, compassion, and individualized care. We don't use scare tactics. We use evidence. Advanced maternal age is a category that helps guide monitoring and screening. It is not a verdict on your pregnancy outcome. It does not mean you cannot conceive. It does not mean you will have complications. It means your provider will pay attention to certain factors thoughtfully and proactively. So if you're over 35 and thinking about pregnancy, already pregnant, or somewhere in between, remember this: data informs care, but it does not define destiny. Evidence-based medicine should shape your decisions, not viral panic. Today we're talking about advanced maternal age, the phrase that TikTok treats like a medical emergency siren. You hit 35 and suddenly the internet acts like your reproductive system just shut down overnight. Let's take a breath and talk about what this really means in real-life evidence-based medicine. Advanced maternal age is simply a clinical term for pregnancy at 35 or older. It's used because certain risks statistically increase with age. That's population-level data, not a personal prediction about your body. The increase in risks like chromosomal differences or certain pregnancy complications happens gradually over time. It's not a switch that flips the day you turn 35. But here's the part that often gets lost in viral conversations. Age is just one variable in a very complex equation. Pregnancy outcomes are influenced by many factors, and overall health plays a massive role. A 38-year-old who exercises regularly, maintains balanced nutrition, manages stress, and has well-controlled medical conditions may experience fewer complications than a 25-year-old with uncontrolled diabetes, untreated thyroid disease, or chronic hypertension. Chronological age does not automatically equal biological health. Your cardiovascular health matters. Your metabolic health matters. Whether you smoke or vape matters. Your access to prenatal care matters. Even your support system and stress levels can influence outcomes. When doctors assess pregnancy risk, we look at the full picture: medical history, medications, lifestyle factors, prior pregnancies, and family history. Age is noted, but it is not the only lens through which care is provided. Social media often reduces this topic to a single number because numbers are simple and dramatic. But medicine is nuanced. For example, two people who are both 36 can have very different fertility experiences. One may conceive quickly without intervention. Another may need fertility support. The difference isn't explained by age alone. Ovarian reserve, sperm quality, underlying conditions like endometriosis or PCOS, and pure biological variability all play roles. It's also important to acknowledge that modern medicine has significantly improved pregnancy monitoring. If someone is over 35, providers may recommend additional screenings or closer observation, not because disaster is expected, but because preventive care is proactive. Monitoring blood pressure more closely, screening for gestational diabetes, and offering genetic testing are ways to support healthy outcomes, not signs of inevitable problems. Another layer to this conversation is the reality of modern life. Many people choose to delay pregnancy for education, career goals, financial stability, or finding the right partner. Those decisions are complex and valid. Medicine's role is not to shame people for timing, it's to provide accurate information and individualized care whenever pregnancy occurs. Fear-based messaging tends to strip away context. It ignores the fact that millions of healthy babies are born each year to parents over 35. It ignores advances in prenatal screening and maternal care, and it ignores the variability of human biology. So yes, age is a factor, but it is one factor among many. It does not override your overall health, your preparation, or your access to care. Advanced maternal age is a statistical label, not a diagnosis and not a destiny. Your body is more than a number, and your care should reflect that. Today, we're still unpacking advanced maternal age and the way social media turns it into a horror soundtrack. One thing that often gets completely overlooked in those dramatic TikToks is how much prenatal screening and medical technology have improved. If you're 35 or older and pregnant, the story is not just about increased risk. It's also about increased information, better tools, and more options than ever before. Years ago, if someone was considered higher risk because of age, the screening options were more limited and often more invasive. Now, we have non-invasive prenatal testing, commonly called NIPT, which uses a simple blood draw from the pregnant patient to screen for certain chromosomal conditions. It analyzes small fragments of fetal DNA circulating in the bloodstream. That's incredible. No needles in the uterus, no major procedures just to get basic screening information, just a blood test. We also have high-resolution ultrasounds that allow detailed evaluation of fetal anatomy. The anatomy scan around 18-22 weeks gives providers a comprehensive look at organ development. If anything appears outside the expected range, patients can be referred to maternal fetal medicine specialists who are trained specifically in high-risk pregnancies. That level of subspecialty care adds another layer of support. For those who want diagnostic certainty rather than screening probabilities, options like chorionic villus sampling, CVS, or amniocentesis are available. These tests provide definitive genetic information. They are invasive and carry small risks, which is why the decision to proceed is personal and based on individual values and risk tolerance. The key point is that families today have choices. Information is not forced, it is offered. Genetic counseling is another powerful resource. A genetic counselor can sit down with you, review your family history, explain test results in understandable language, and discuss what different outcomes could mean. This isn't about scaring people. It's about empowering them with knowledge so they can make decisions aligned with their beliefs and goals. Being 35 or older often simply means these screening conversations are initiated automatically. It doesn't mean something is wrong. It means the healthcare system recognizes statistical trends and offers proactive tools in response. Many patients find reassurance in additional testing. Others choose minimal intervention. Both approaches can be valid when informed. Social media tends to present risk without discussing solutions. You'll hear, "The chances go up," without hearing, "And here's how we monitor and manage that." Modern obstetrics is built on early detection and preventive care. Monitoring blood pressure helps reduce severe preeclampsia outcomes. Screening for gestational diabetes allows early management. Tracking fetal growth can identify concerns before they become emergencies. Another important point, screening tests do not equal diagnoses. A screening test estimates probability. If a result comes back high risk, it does not automatically mean the baby has a condition. It means further evaluation is recommended. That distinction is critical and often lost in short-form content. So yes, age can influence which options are offered, but those options exist because medicine has advanced. Advanced maternal age today comes with more data, more surveillance, and more support than ever before. Information is not the enemy. In many cases, it's a source of reassurance. Evidence-based care isn't about predicting doom, it's about preparing thoughtfully and responding early when needed. Let's talk about the pressure, not the medical pressure, the social pressure. Because when it comes to advanced maternal age, TikTok doesn't just talk about statistics. It pushes a narrative. It tells people there's a ticking clock so loud you should be able to hear it across the room. It implies that if you're not pregnant by 30, you've somehow failed a biological deadline. That messaging ignores real life. Fertility is personal. It is influenced by age, yes, but also by genetics, overall health, reproductive history, sperm quality, underlying conditions like endometriosis or PCOS, and sometimes factors we still don't fully understand. Two people of the same age can have completely different fertility experiences. One may conceive on the first try at 38, another may struggle at 27. Age is a factor, not a guarantee. What often gets lost online is that life timing is complex. People pursue higher education, they build careers, they work toward financial stability, they wait to find the right partner. Some are healing from past relationships, some are managing chronic health conditions, some simply don't feel ready and emotionally or practically until later. Those are valid reasons. Reproductive decisions do not happen in a vacuum. There is also this idea that you must choose between ambition and family, as if fertility is a race against professional growth. In reality, many people successfully balance both, sometimes at different stages of life. The modern reproductive landscape looks very different from decades ago. More people are having children in their mid to late 30s and early 40s, and many are doing so safely with proper medical support. We also need to acknowledge that fertility awareness doesn't mean fear. Yes, fertility gradually declines with age. That is biologically accurate. But awareness is different from panic. Understanding your options, whether that's trying naturally, consulting a fertility specialist, or exploring egg freezing, should come from informed discussion with a healthcare provider, not from a 20-second viral clip designed to create urgency. The "you're running out of time" narrative can create unnecessary anxiety. Stress itself doesn't help fertility. Constantly feeling like you're behind can impact mental health, relationships, and self-esteem. Reproductive choices should be rooted in readiness and informed consent, not shame. It's also important to remember that there is no universal reproductive timeline. Some people become parents at 22 and thrive. Some become parents at 42 and thrive. Some choose not to become parents at all and thrive. Biology provides ranges, not rigid life scripts. When we reduce fertility to a countdown clock, we ignore individuality. We ignore that some people need assisted reproductive technology at 30, while others conceive naturally at 39. We ignore socioeconomic realities. We ignore personal autonomy. The goal of medicine is not to pressure people into earlier pregnancies. It's to provide accurate information so people can make decisions aligned with their values and circumstances. Fertility is not a competition. It is not a moral achievement unlocked by a certain age. Your timeline is yours. Data can inform it. Social media should not dictate it. Let's end with something that might be the most important part of this whole conversation. Fear-based advice is not medical advice. Social media thrives on urgency. It rewards dramatic headlines, shocking statistics, and phrases like "doctors won't tell you this" or "they're lying to you about fertility." That kind of messaging is designed to trigger emotion, not to provide balanced information. In real life, in an actual exam room, medicine does not operate like that. When we talk to patients about age and pregnancy, we talk in context. We explain relative risk versus absolute risk. We clarify what a percentage actually means. We discuss options. We answer questions. We individualize care. What we do not do is sit someone down on their 35th birthday and announce that everything is downhill from here. The phrase "doctors won't tell you" is particularly misleading. Obstetric providers absolutely discuss age-related risks. We talk about chromosomal changes, miscarriage rates, blood pressure disorders, gestational diabetes, and fertility trends. The difference is that we present the information with nuance. We don't present it as a catastrophe. We present it as data that helps guide monitoring and decision-making. Fear-based content often removes that nuance. It takes a true statistic, like risk increasing with age, and strips away scale and context. It rarely explains how small many of those increases actually are. It rarely discusses how modern prenatal care reduces complications. It rarely acknowledges that most pregnancies over 35 result in healthy outcomes. Fear spreads faster than reassurance, and algorithms reward whatever keeps people watching. Another problem with panic-driven advice is that it can push people into rushed decisions. Feeling pressured to conceive before you're emotionally, financially, or relationally ready can have long-term consequences. Decisions about family planning deserve thoughtful reflection, not urgency created by a viral clip. Fear can also discourage people who are already pregnant. Someone who is 36, happily expecting, may stumble across dramatic warnings and suddenly feel anxious about something that statistically is still very likely to go well. Anxiety without context does not improve outcomes. Clear communication and supportive care do. Evidence-based medicine is built on transparency. If there is a meaningful risk, we discuss it. If there are ways to monitor or reduce that risk, we explain those too. If additional screening is available, we offer it and respect the patient's choice about whether to proceed. The goal is informed consent, not compliance driven by fear. It's also worth remembering that social media creators are not reviewing your medical history. They don't know your lab results, your blood pressure trends, your ultrasound findings, or your overall health. Your healthcare provider does. That personalized knowledge matters far more than generalized warnings. Being informed is empowering. Being scared is not the same thing as being informed. Advanced maternal age is a clinical category, not a crisis announcement. If you have concerns about your personal risk, that conversation belongs in a medical setting where your individual situation can be evaluated thoughtfully. Your reproductive decisions deserve evidence, context, and compassion, not clickbait. So if you're over 35 and pregnant, you are not geriatric. You are not reckless. You are not irresponsible. You are a human being whose body deserves evidence-based care, not algorithm-based panic. Advanced maternal age is a data category. It is not a destiny. And if you ever have questions about your personal risk, that's a conversation for your healthcare provider, not your For You page. Stay informed. Stay critical of viral advice. And remember, your reproductive choices belong to you.